Hi. Hi, everybody. It's Dr. Nancy Elwartowski-Cooper. Today I have with me Tamara Richardson from Indy Doula Associates. Tamara is a doula, and she's going to share with us some for having a healthy pregnancy and a labor outcome. So take it away, Tamara.
Hi, Dr. Nancy. Thank you so much. Okay, so these are my 5 tips for a healthy birth outcome that I run through with every client that comes through our agency. So I am the director of Indy Doula Associates, and we have an agency of doulas, and we'll talk a little bit more about doulas at the end. So my first one is for mothers and their partners to be choosing the right care provider for them. A lot of women have their OBGYN, and they, especially for first-time moms, their gynecologist becomes their obstetrician. And they may really love their gynecologist for their gynecological care. But is that the right care provider for you for birth? It's a very different thing. And so understanding if your birth vision matches the kind of birth that they do, then you're in a great team. But if your birth vision is very different from what your obstetrician is normally handles births, how they do it, then it might not be the greatest match. You have to decide whether or not you want active management, which is typically an obstetrical model of care, or a more expectant management, which is usually the midwifery model of care. That's not to say that some OBGYNs don't practice a more expectant way. It's just really figuring out where you feel most comfortable. My second one is choosing the right venue for your birth. So just as much as the care provider is important, the venue is important as well. Venue meaning which hospital. If a hospital birth is what you want to have, which one? Because there are certain hospitals that are going to be great for the moms that want not a lot of intervention or not a lot of pain management. And there's other hospitals that are great for moms that do want a more active management. There's also a birth center in Indianapolis now with Sacred Roots. And so you can choose birth center, or you can even choose, you can even choose from home births. There are plenty of home birth providers now around Indianapolis. And it's great that parents here have from home to birth center to hospital options. My third tip is nutrition. It seems like an obvious one, like you have to eat right when you're pregnant, but what are you eating? How much of what you are eating? Are you eating what you're supposed to be eating? And so I go over this a bit with clients and then recommend that they often talk to their care provider about nutrition, of course, but also look over the Dr. Brewer pregnancy diet, which can be really great for normal, healthy moms, as well as moms that might have experienced preeclampsia in the past or gestational diabetes in the past or are dealing with it at that moment. And then if necessary, working with a nutritionist if they really are struggling with how to change their diet for their pregnancy. My fourth one you'll like. You're going to like this one. It's chiropractic care. I ask every single client, who's your chiropractor? Not, do you have one? Who is your chiropractor? And if they say, I don't have one, then they get our referral list, which Cooper Family Chiropractic is at the top of. It is just, for all humans, I'm preaching to the choir here about chiropractic care, but especially for pregnant women and then postpartum for their babies. Really lining up and having optimal fetal positioning and how chiropractic management can really set mamas up for sometimes a faster birth because everything is in line. Their body is, their baby's in a good position, and we have faster births that way when we don't have like a more difficult presentation of a baby. And then my last tip is hiring a doula. Studies show that births where doulas are present are so much more likely to be less pain management when moms don't want that, and just healthier overall birth outcomes, how they feel about their birth. They're more likely to breastfeed successfully. It's a support for the entire family, not just for mom, but for her partner, be that a husband, a boyfriend, a life partner, her parents, a sister that might be coming. We're not there to replace anyone, but to provide emotional, physical for the birth, and educational support from the moment that we are hired in pregnancy through that birth continuously, and then postpartum. So we stay in contact. We also have in our agency postpartum doulas. Our culture is horrible when it comes to postpartum care for moms. It's sort of like, you had your baby, everybody's good, go home, you're done. And we're not. Yeah. We need help. Right. And then just making sure that if those resources that they need, whether it be pelvic floor therapy, seeing a chiropractor for a baby, for parents that just forgot through their prenatal care with us, you know, that, oh yeah, this could be helped by a chiropractor. Perinatal mood disorders, all of those things we're looking for, and assisting the families with resources so that they can continue into healthy parenthood and motherhood and fatherhood from there. And we also encapsulate placentas for the moms that want to do that.
I heard that postpartum doula might even do some vacuuming. Is that
you
true?
know, I absolutely have. I have chopped vegetables, I have washed dishes, I have done laundry, and I have held little snuggly babies so that moms and dads can sleep overnight. So I am all about overnight postpartum care. You want me to come over and do some housework and snuggle your baby and you sleep, and that makes your daytime easier, and you've got everything's better with sleep. You know, we don't want to be hungry and tired. So I'll prepare a meal for you, and I'll put you to bed.
I do in Carmel here, and well, actually the Indianapolis area, there's a lot of families that don't have family in town. And I run into that a lot. So hiring a postpartum doula would be fabulous for, you know, these people that, you know, don't have families here that can't come and, you know, let the parents sleep, because it's so important to do that.
Right.
So
I don't have family. I mean, I have in-law family here, but my own mom, she's 800 miles away. So it's a real thing. We definitely have a lot of families that maybe they can rely on a church group to make meals, but other people have children and they can't leave their house overnight to come to your house overnight.
Right. No, that's great. Wonderful service. So when you're when you're in the hospital or at a birthing center, and I do see that doulas are hired for the birthing center too, even though they have midwives there. I see doulas are helping the moms too. So what do you really do when you're with the mom or you know, in a hospital or in the birthing center?
Yeah, it's physical comfort measures a lot, especially for moms that are looking for a natural birth, or they know, I want to have pain medication later, but I want to get, you know, we want to get them in established good labor before they choose that. Some mamas are choosing that and they've changed their plan and they choose that later. But we're doing a lot of physical comfort measures, hip squeezes, sacral pressure, getting them moving around, seeing how their labor is going and saying, you might want to try a belly lift. Let's get that baby more engaged in your pelvis. Or does it seem like this baby's trying to be born asynclitic? Let's move you around. And so we're there continuously doing physical things, but also helping the family understand what their care providers or nurses are saying in like real language, helping them make informed decisions. You know, so if I know a client has questions or concerns about something and they just don't know how to ask that question, I don't speak for them, but I open the floor for them to ask their questions. And then I ask questions as well so that I can pull that information out of a nurse or a doctor so that the family can make an informed choice. Whatever that choice is not up to me. It doesn't matter to me, for myself. It's that it matters to me that they are making a choice that they feel empowered about and strong about and convicted about. And whatever it is, if it's every bell and whistle the hospital has, pain medication, you don't have to apologize to your doula. We understand. We'll get you there. And then after pain medication, if that happens, is on board, we still have work to do. You know, we might be dueling mama's thoughts. I would love to see you go to sleep if it's been a long birth, but now moms are awake and they're talking and maybe even dealing with some emotions about the change in their preferences. We don't like to call it plans. We like to say preferences. You know, in the cases of surgical births, we're there to continue to support the family. Depending on the hospital, we can go in with them, but definitely being there in recovery. Mama's on a lot of medication. Dad or partner might need a lot of support and helping establish breastfeeding and making sure that everybody is healthy and stable and supported. Right along next to the midwife or the care. You know, we're not there to do their job. They're taking care of that clinical aspect, and we're there on the end of, you know, the emotional and physical care.
That's great. I know that a lot of doulas, and you guys really are passionate about what you do. I really regret not hiring one. I didn't know enough about them, which is why I wanted to do this broadcast with you, because back 14 years ago when I had my daughter, I didn't have one. And my husband slept on the couch while I did everything. So it would have been at my birth, but I'll take the postpartum stuff. I'm, 14 years later. Is that okay? Would you still come let me sleep?
You can hang out. That's all right. There's no cutoff to the age limit at all. I didn't have a doula either the first time. I didn't even know what that was. You know, I brought my mom, who had 5 natural births, and my husband who took all the classes because they'll help me. No, my mother knew how to do it for herself. My husband forgot everything. And then I got an epidural that I didn't really want to have, you know, and it wasn't their fault. You know, she was my mom. She's seeing her baby uncomfortable and didn't know the skills and the tools to tell me to do. And so the second time we had a doula, and it made a world of difference. He did not look like the deer in the headlights. And I don't think if we ever had any more children, I probably wouldn't be allowed to have another kid without a doula. He wouldn't come.
Great. Well, Tamara, thank you for your tips. I really appreciate it. And we're going to put a link below this video for Indy Doula Associates for your company. But I really appreciate you coming on and talking. And, we're going to try to do these weekly. So we'll have you come back on and, maybe do some more tips for our moms in the future.
Absolutely. Anytime, Dr. Nancy. You know we love you.
All right. Well, thanks, Tamara. We'll see you soon.
Welcome. Bye.
Bye.